you guys had a bad experience getting an IV. Well, it's really important to have the correct steps to start an IV in order to satisfy patients and decrease infection rates. So first I'm going to get started. I'm going to gather my supplies, which would be my IV start kit, my clean gloves, my saline flush, and the correct gauge IV catheter. Then I'm going to do my hand hygiene, so I'm going to wash my hands before going into the room. Good hand hygiene is highly important in order to decrease the incidence of site infections. Wearing gloves protects the healthcare personnel from potential bodily fluids. Then I'm going to identify the patient. After going into the room, I'm going to verify the correct person by comparing the patient's armband with the order. I'm going to have the patient state their name and date of birth and verify that the bracelet is correct. Then I'm going to assess the patient for a potential latex or adhesive allergy. So then I'm going to start my initiation process. I'm going to open the kit and assess the site. I'm going to assess the arm for any areas to avoid as redness or swelling, or they have an arm that's a no-stick arm. So now I'm going to show you how to put on a tourniquet above the insertion site. So I'm going to pull up her sleeve and go around. It's going to be a little tight. I'm going to push this underneath, and that's how you put on the tourniquet. And you pull this to pop it off. So I would palpate the site, feel for a spongy vein, and then feel where the vein is running towards. And then I'm going to prime my extension tubing with saline. I'm then going to clean the site, remove the tourniquet while I clean the site, reapply my tourniquet, put on my clean gloves, and allow the site to dry. I'm then going to open my IV cannula packaging. I'm going to stretch the skin distally, puncture the skin at about a 30 to 45 degree angle with the bevel of the needle up. When the blood comes into the flash chamber, I'm going to advance the needle slightly, use my pointer finger to advance the catheter into the vein and engage the safety device. Remove the tourniquet and attach the extension tubing and flush the IV. I'm going to assess for any redness or signs of infiltration such as swelling. I'm then going to secure with a Tegaderm, make sure it's a clear, occlusive dressing. Tape the extension tubing to the arm with the initial and date of the site. I'm then going to clean up. I'm going to put the needle with the safety engaged into the sharps container, throw away all other used supplies, remove my gloves, and wash my hands. Then I would document the initiation of the IV, the site, gauge, and amount flushed, the patient tolerance, and the site assessment. So following the correct steps to start an IV can give patients a better hospital experience as well as prevent potential infections of the insertion site.